Hello everyone, I am a doctoral candidate in educational administration. Today I will focus on psychology, health education. Management in higher education. This is my basic information. PI student of doctoral degree of education program, educational administration, graduate school, Swanson Nanda Rajabat University institutions. Structured into 6 sections. First, the current situation of psychology, health education, management of higher education. Next, problems and challenges in psychology, health education, management of higher education. Fourth, reference for mental health education, management in higher education. Next, exploring the characteristic path of psychology, health education, management of higher education. Conclusion. Next, I will introduce the introduction. Psychology, health education is essential for cultivating well-rounded individuals and has become a key focus in school education management. Ministry of Education, National Health Commission, and other departments issued policies like basic standards for psychology, health education in universities to enhance students' psychological well-being and resilience by establishing and improving college psychology health education systems. Growing importance. Increasingly diverse student backgrounds require enhanced mental health education management, with counseling centers and systematic mechanisms. Existing challenges: insufficient professional personnel, incomplete institutional systems, and delayed psychological intervention mechanisms. Response measures strengthened via policy guidance, multi-party collaboration, systematic management models, and combined implementation efforts. The current situation of psychology, health education, management of higher education. Current status and challenges. System strengthening. Universities have built counseling centers, offered courses, and promoted mental health awareness. Existing challenges: shortages of professionals, insufficient resources, lack of crisis prevention mechanisms, and uneven development of facilities. Improvement strategies: enhance coordination, strengthen teams, and optimize support for scientific management, theoretical and policy support. Interdisciplinary basis based on education, psychology, management science, ecological systems, and positive psychology theories. Policy role: key factor promoting development by emphasizing counseling centers, curriculum, integration, and preventive services. Global initiatives: international organizations stress supportive policies and inclusive environments for student well-being. Implementation and issues: resource allocation. Universities set up counseling centers with counselors but face resource imbalance and personnel shortage. Education and training: integrate courses into public electives, expand formats via lectures and group counseling, and train faculty with provincial programs. Crisis and collaboration: established crisis intervention mechanisms, but face non-standardized responses, coordination gaps, and family or social cognitive lag. Problems and challenges in psychology, health education, management of high education: insufficient professional mental health staff and inadequate financial support. Limit program development. Economically developed regions have abundant resources while less developed areas face financial constraints and facility shortages. Weak institutional support, low awareness, and remote or minority region challenges hinder effective education. Family environment significantly influences effectiveness, but parents lack awareness and support ability. Weak school-family communication and limited community involvement. Constrained support systems, inconsistent policy implementation, unclear administrative responsibilities, and coordination gaps. Reduce operational efficiency. Reference for mental health education management in higher education. 3-tier network: school or district or municipal with systematic courses and psychology health month activities. Internet plus mental health platforms for assessments, consultation booking, and dynamic data tracking with government support. School community medical network, diversified educator training, and family school linkage programs. Designated school counselors, multidisciplinary teams, cell courses, and legislative safeguards like youth psychology health services. Act psychological first aid training for teachers or students or parents. Healthy school standards and national counselor certification system. Well-being education in national frameworks. Multidisciplinary student support teams and preventive or developmental curriculum design, exploring the characteristic path of psychology, health education, management of high education. Incorporate ethnic minority cultures into curricula. Develop bilingual teacher teams and organize cultural activities. Establish forest therapy bases and integrate tea, culture, or agricultural activities for stress relief. Develop student psychology health service platform and a multilingual app with AI-assisted risk identification. Strengthen policy direction, funding, full-time counseling roles, course integration, and facility improvement. Establish psychological service alliance and 4-in-1 crisis intervention mechanism. School or doctor or community or family focus on first-year students, stress students, and social adaptation challenges with stratified interventions and early warning systems. Combine mental health management with professional development to enhance job satisfaction and reduce burnout. Provide counseling, training, academic exchange, career planning, and supportive organizational culture. Integrate mental health management, professional development, and organizational culture to form a positive cycle. Conclusion. Development pathways. Key strategies. Develop distinctive pathways aligned with institutional culture. Avoid simple replication and involve multi-stakeholder coordination. Technological empowerment. Leverage digital tools to enhance education and support services, catering to diverse student needs. Through multiple channels, system building. Combine institutional support, professional services, and innovative approaches to create accessible resource environments. Framework integration. Integrate psychological education into teaching, counseling, and campus culture. For a coordinated, sustainable framework, student well-being improves psychological well-being, strengthens governance effectiveness, and fosters positive campus environment. Higher education development supports long-term quality enhancement and equips universities to comprehensively address mental health challenges. Thanks.